Hello everyone, I'm Dr. Tefe Debbie. I'm a consultant psychiatrist and a psychologist. I do videos on mental health education and self-improvement tips. My goal is to help demystify mental illness and help you be your best and live your best. On today's video, I will be talking about a condition called major depressive disorder, otherwise just simply called clinical depression. It is said to be the commonest type of mental illness, affecting about 10% of the world's population. As much as it is quite common and also said to be the #1 leading cause of disability, it's often a condition that is often misdiagnosed and underdiagnosed. The simple reason is that often people don't recognize it when it's going on, either in their lives or in someone else's life. I mean, at some point in life, everyone will go through some form of challenge, one or the other. And we often think that because we go through challenges and then we experience various forms of emotions such as anxiety, anger, irritability, sadness, then it means that we have experienced depression. But clinical depression is not as simple as that. Yes, life events may trigger it, but it is not always the cause of clinical depression. And then secondly, sometimes one goes through clinical depression as having the same symptoms that you will see when someone goes through life challenges, but the difference usually is the level of the functioning and the duration of the symptoms. So on today's video, I will be talking a bit about what are the symptoms, the signs and the symptoms that you will see in clinical depression. Using the International Classification of Disease, there are 3 cardinal symptoms of depression. Number 1 is a feeling of low mood, a persistent feeling of sadness. Number 2 is loss of interest in previously pleasurable activities. So the individual is no longer excited about things that used to excite them in the past. And number 3 is low energy or being easily fatigued. Now, apart from these 3 cardinal symptoms, there are other symptoms of depression, which includes an increase in appetite or a reduction in appetite. So simply put, there may be a change in appetite. The individual may not feel like eating as much as they used to eat, or they may find themselves eating a bit more and binging. Another thing that could happen, another symptom of depression, is a change in sleep patterns. So the individual may find it difficult to fall asleep or to sustain sleep, or find themselves waking up intermittently at night. But classically, it could be a reduction in sleep or an increase in sleep. But classically, there is something called the waking up early, 2 hours before your usual time. So someone classically who's experiencing depression may find themselves waking up a bit earlier than they used to. Now, this is not always the case, but this is often the case. And they may not find it difficult to fall asleep, or they find it difficult to stay asleep. Another symptom of depression is pessimism. So the individual is pessimistic about the future, is pessimistic about situations, is pessimistic about themselves and about others. So you may find the individual also having some sense of self-guilt, feeling guilty, and overwhelmingly feeling guilty even over the little things, of things that have happened in the past or the things that are happening currently. So there is self-guilt. And another symptom is a sense or a feeling of hopelessness, like there is no future, I can't see a future. And with it, there is some sense of learned helplessness, where the individual feels like there is nothing I can do that will make much of a difference. Another symptom that is seen with depression are thoughts of suicide. So the individual may just feel like, maybe I'm better off dead, maybe everyone will be better off not having me around, and such thoughts, and sometimes may go out to actually carry out that thought. With depression also, another symptom that could be seen in depression is low libido. So there is a disinterest or a reduction in interest in the desire to have sex. To make a diagnosis of depression, there has to be at least 4 of the symptoms that I have talked about, and the symptoms should have lasted for at least 2 weeks duration. In other words, it should be present most part of the day for this period of 2 weeks minimum or longer. Now, I hope with this video, you'll be better able to identify it and better able to recognize it either in other people or in yourself. Just in case you have not already subscribed to our YouTube video, can you kindly do that? That way you don't get to miss out on any of our subsequent videos. Thank you very much.